So with respect to people getting sick and COVID and RSV and flu, it turns out only 15% of Canadians age 5 and up actually got updated COVID vaccines in the fall. Okay, and that's up until about 2 weeks ago.
Yeah.
So there's a lot of concern here. We heard our health minister speak out about this the other day, right? Saying, look, they're there, they're available, they're free. You need to go because people are getting sick and ending up in ERs.
But I maintain that I think a whole lot of people had COVID so recently. And I know that's not the only factor here, but I think that is a factor in those low vaccination rates. And does this new vaccine work against the new variant?
And how much of this, and we bring this up again, is COVID fatigue? The fact that, you know what, you had your 2 or 3 boosters and you figure in your own mind, your logic says, well, that's enough. Of course, it doesn't work that way. Dr. Peter Hotez is on the line. He is the author of a book called The Deadly Rise of Anti-Science, A Scientist's Warning. He joins us now. Dr. Hotez, thanks so much for being here.
Oh, thanks so much for having me.
Can I begin by bringing up this COVID fatigue idea? Before we talk about anti-vaxxers or anything else, there are plenty of people out there who went and got a first booster, second booster, who it seems to me anyway, are simply saying, I've done my part, I've done enough, and there's no reason for me to get another vaccine. How misguided is that?
Well, I think, there's some of that thinking. I think the other piece to this is that I think a lot of Canadians and certainly a lot of Americans are not aware that this new immunization is different from the previous ones and that it's specifically tailored for the variants that are currently circulating, whereas the previous vaccinations are not so great at the currently circulating variants. So that's the most important reason why you need to get it. Some people call it a booster. Our U.S. Centers for Disease Control in the U.S. is calling it an annual immunization. Whatever you want to call it, you should get it because we are still seeing individuals who've gotten some of the previous vaccinations still get hospitalized because they're not as well protected against this new circulating variant that the protection from the new vaccine will afford.
I feel like that's a rhetoric that's still going around too, is this idea that, well, it's no big deal now. Like COVID's just become like your normal flu or your normal cold, so I don't really need to worry about it. Is there truth in that?
No, I mean, the hospitalizations are real. They're going up and pretty precipitously. We were at around, in the U.S., and I assume looks like it's similar to Canada, we were around 6,000 hospital admissions on a daily basis in the United States back in early July, and now we're up to about 25,000 hospitalizations, so a huge increase. And what's concerning is when you look at the slope of the curve, the trajectory is going up pretty precipitously. That's point one. The second is things are pretty bad in England right now, and if you remember the last few years of the pandemic, when things go bad in England, it's only a matter of time before things go badly in North America, so that's a concern. And then lastly, this new variant that's coming up, this JN1 variant, is highly resistant to previous vaccines. It will do better with this new one.
I know we ask this every time there's a variant, when it was Omicron, whatever it happened to be. So this one, I understand, is more, I don't want to say it's deadlier because it's not, but it spreads quicker than the previous one. Do we know that?
Yeah.
Is it more contagious?
It's highly contagious, and it has some escape properties. And even if the deaths aren't going up, there are 3 things that are happening. One is hospitalizations, meaning severe illness. So that's a reason you want to get this new vaccine. Second, long COVID. Now we have data to suggest that if you keep up with your boosters, you're less likely to get long COVID. And that's important because who wants to get long COVID, especially this time of year? And then reason. And that story is still evolving, but it looks as though after you've had COVID, you're more susceptible to heart attacks. And that's because the virus is getting into the plaques that line the coronary artery and causing inflammation and potentially for them to break off. We don't have all the I's dotted and T's crossed the mechanisms, but we're seeing heart attacks go up after COVID. So three good reasons. I know I sound like a broken record to get your updated immunization.
I just want to ask, with respect to the heart attack situation after you've had COVID, is there a time frame in here? Is it a week, a month, 6 months? Do we know?
Yeah, the answer is yes to all the above. We don't have, it looks like it's sometime after getting COVID, and to me that looks about the right window, weeks, days, weeks, and months, but that still needs to be better pinned down. This is a relatively new finding.
Okay.
Okay, and as of just, I want to say 2 weeks ago here in Quebec, we were finding out that 10 to 20 people a day were still dying from COVID. And yet I feel like, again, we've shifted away from it. We're like, no, we're not taking it seriously. Are we seeing numbers like that in England? When you say that it's bad in England, is it infection or is it also deaths?
It's hospitalizations.
Okay.
I don't know about I have to look at the deaths, but definitely the hospitalizations. And we know. And when you talk about hospitalizations, it's important to think about long COVID, because even though long COVID can occur after any COVID case, even asymptomatic COVID, the risk goes up with severe illness. So that's why vaccinating does seem to have an impact on COVID as well. And a lot of people who want to disparage vaccines conveniently forget all of that important stuff. And now with the new information about heart attacks, this is another reason. And by the way, we still have something called influenza going up, and so that's rising. And then we have a new RSV vaccine for seniors. So we have a whole new slate of adult immunizations, and we have to kind of build that ecosystem up. That because when you think about vaccinations, the pediatricians, I'm a pediatrician, trained as a pediatrician. You learn a lot about vaccinations as a pediatric house officer, as a resident, not so much on the adult internist side. So there's still a learning curve for the adult internist as well, with all these new adult immunizations coming online.
If you'll just allow me, we've talked about the long COVID a couple of times on the show, because it's one of those things that so many people have actually reported now, whether it's 6 months, a year, however long. Are you seeing research kind of heading in the right direction, any kind of inroads as to how to treat this?
Well, there's been a lot of fascinating work done on the mechanisms of it, which is a first step towards uncovering treatments. And they have to do with activating a certain brain cell called a microglial cell, creating some kind of autoimmunity response, reactivating latent viruses like Epstein-Barr virus. So these are all postulated mechanisms. And if you know that, then you can start thinking about designing long-term therapies. Another question I get asked a lot is, how long does long COVID last? Is it in perpetuity? Probably not, but it can go on for some time. And for many people, unfortunately, it can be pretty debilitating. And by the way, that's true for kids as well. So there are studies to show that kids are at risk for long COVID. So that's another reason to get your kids vaccinated.
All right. The book for people who want to follow along here, The Deadly Rise of Anti-Science, A Scientist's Warning. It is Dr. Peter Hotez. That name, by the way, or Hotez, Hotez. Doctor, thank you so much for your time. It's always a pleasure having you on.
Very much.
Thanks so much. I appreciate the opportunity.